we always hear about cancer, but only on pamphlets in very high terminology. So today, I'm excited to learn the normal things from you.
Yes.
So to just jump straight into it, what is cancer?
Well, cancer occurs when there's genetic mutations, in abnormal cells start growing rapidly.
Okay. When you say mutations, what do you actually mean?
Changes,
Oh, you see, easy.
genetic changes
Oh,
in
right.
the abnormal cells
Yeah.
that start growing rapidly.
Okay.
Yes.
And then when you say genetics now, since we know it's cancer, does that literally mean that if my mother had cancer, then there's a chance for me to have cancer?
Yes, that's what it means when we talk to genetics. When you have a family history, as we call it, of cancer, for example, your mom, your granny, your aunts, it puts you at higher risk
Okay.
of cancer.
All right. So
Yes.
that's the one way of now getting cancer.
Yes.
Any other?
Yes, we have many other causes, or in the medical terms we call it carcinomas, but it's basically causes.
Okay.
We have your physical causes,
Yeah.
which is, for example, exposure to your ultraviolet rays, your
Yeah.
radiation. That is basically your X-rays.
All right.
The ultraviolet rays is the UV lights as we know it. You know the blue lights that we use for
The
our nails? Yes. So
All
those
right.
also can put you at risk of cancer, because they also cause as we said, the abnormal changes in the cells.
Okay.
Yes.
Okay.
We also have other factors such as physical factors, which is our lifestyle.
Okay.
This speaks to your exposure to or use of alcohol,
Alcohol can
tobacco.
actually give you
Yes.
cancer.
It increases your risk. It doesn't necessarily
Okay.
give you cancer, but it increases you. It puts you at an increased risk.
Okay.
Yes. Alcohol and tobacco. Yes. Also other, like, the type of, not necessarily the type of food, but exposed food and exposed water.
Okay.
Yes. And then we also have other factors like chemical, as we call it, factors or causes, which is exposure to pathogens, bacteria, infections, those type of things. They can also put you at an increased risk.
So when you say chemicals, can it be your daily cleaning detergent type of chemicals or in water? Okay, all right, cool.
Yes, yes,
Okay, okay.
yes. So those are your type of causes or factors that increase your risk, and therefore it is important to screen early screening. When we speak cancer, we speak early detection, screening, early detection.
Okay.
That is what we do when we speak cancer.
So when I hear screening, I just think of embarrassment, and I think
Invasive
of awkward.
tests
Yes,
and
my
needles
privacy.
and things.
Yes,
No,
yes.
no screenings. Let me give you an example. We have a lot of screenings because we have a lot of types of cancers.
Yeah,
Not to go into detail, but we have, for example, your prostate,
yeah.
where they do the physical. The doctor actually, or the nurse physically examines the prostate. They can also do a blood test.
Yeah. Is there an option? I can like skip the
Yes.
physical and then do the blood test for the guys. That is
Yes,
okay.
they are eventually going to do both of them, but
Oh,
yes,
no,
normally
I'm funny.
for at about a certain age for the guys, those above 45, we do the PSA blood, that we call a blood test.
Yeah.
That we screen for. Yes, for
Okay.
the guys, and then for the ladies, we have the cervical
Yes,
screening.
let's talk about that.
Well known as the pap smear.
Yes.
Everybody, there's a lot of stigma around the cervical screening test. It is not painful.
Yeah.
It is uncomfortable. It's
Yes.
uncomfortable.
So
to
they
do.
are gonna see you naked. That's what you are saying to
Yes,
me.
they are
All
gonna
right.
see you naked.
All right. It's out there.
Nakedness is there. It's
Yeah.
uncomfortable. It's not
Yeah.
painful. It's uncomfortable to expose your body.
Yeah. Yes.
Doesn't matter
definitely.
which part of the body it is.
Yeah.
For somebody to put something in your body,
Yeah.
but it's
Talking
not.
about that, can you explain how it happened?
Yes. So basically, it's just we're going to use what we call a speculum.
Yeah.
So it's just a plastic device that we insert in the vaginal area, just
Yeah.
to open the area
Yeah.
to expose the cervix. You need to
Okay.
see the cervix. At the os of the cervix, the os is the mouth actually of
Yeah.
the cervix, and it looks sort of like
Okay.
so the cervix is normally what we measure as when you're giving birth, you know,
Wow,
we
the
do
10%,
the
10
centimeters.
centimeters. All right,
So
all
that
right.
is where the abnormal cells are. So then we're going to
Oh,
use just a thin brush, you know, it's thin like a earbud.
okay.
Yes, and it has little
That sounds
bristles,
safe.
very rubbery, very soft. So
Okay.
then we're just going to use that brush, insert it, turn it a few times just to take some of the cells, the particles of the cells there.
All
And then
right.
we're going to put it in some liquid, obviously a lab bottles from the lab.
Yeah.
And then we're going to send it to the lab where they now test. So it takes less than 5 minutes.
Wow. Okay.
Yes,
5
yes,
minutes of awkwardness to save your
yes.
life. I think that's a fair deal.
Yes, it
I
is.
do.
Yes.
So now, since we got the awkwardness out of the way, I think the one that we're celebrating this month, the breast cancer awareness, can we dig into that?
Okay. So breast cancer is one of the most common killers
Yeah.
of our women and men.
And
Don't forget,
men.
men are also at risk of contracting breast cancer.
What the pink, we focus on ladies and we just
Yes.
think ladies. So that is a
No,
very, very
but
interesting fact.
we tend to forget men also have breast and
Yeah.
breast tissue, which also
Yeah.
puts them at a risk of contracting breast cancer. So with the breast cancer, as I'm saying, always saying early detection.
Yeah.
Okay, so breast cancer, you're going to look for signs of
Yeah.
breast cancer. You know, people tend to think only of a lump.
Yeah,
That is what
yeah.
we've been
First thing.
groomed, you know, the stigma
Yes.
is a lump. We find a lot of signs.
Huh.
Okay, not so many, but there
More
are
than
other
just
signs.
lumps.
Yes, more than
Yeah.
just lumps. So we also have abnormal changes
Yeah.
in the lymph nodes.
Which is
A lymph node is those areas around the enlargements, or
okay.
yes, we call it enlargements. We call it glands in layman language.
Okay.
Yes. So you find you have enlarged glands around the
Okay.
area of the breast.
Yeah.
A lot of times it can be in the axilla, which is known as the underarm or the
Okay.
armpit.
We're learning today.
Yes,
We're learning.
so things like that.
Yeah.
The glands that are enlarged, you find a change in the color
Huh.
of the skin of the breast.
The entire breast or just
Yes, the
the
skin of the breast.
okay.
So
Okay.
it becomes, we call it an orange peel.
Okay.
Okay. You also find abnormalities in the nipple.
Huh.
You might have what we call a nipple retraction. A nipple retraction is when, do you want to guess what
Yes.
happens?
Yes.
Yes,
Okay,
it's sort of like
okay.
it falls in.
Okay.
Yes.
Okay.
Which we don't like when we breastfeed because we always want a
Yes.
protruding or outward nipple.
Yeah.
And then you might find nipple discharges.
Huh.
Okay. Abnormal nipple discharges. Nipple discharges are abnormal.
So if you're breastfeeding, then nipple discharge is very normal. So how would you know
Yes.
that that is now
Then you
abnormal?
need to go for the exam, for a proper breast
Okay.
exam. and
Okay.
test. Yes.
Alright.
You also find changes in the sizes of the breast. You find your breast, you know your normal size of your
Yeah.
breast, there might be a reduction in the size of the breast,
Okay.
or the breast might become enlarged. Not
Okay.
both or one of the breasts. You find one is bigger than the other
Huh.
one. You understand? So
So they normally are. One's always bigger than the other, but now you mean it's abnormally
abnormal.
Okay,
Yes, yes,
okay.
yes, abnormal. And even the lumps, people tend to think I have a lump, it's not painful, it might not be
Yeah.
cancer. If you have a lump, you need to get it checked
Huh.
out. This is where you're gonna go to your local clinic or your doctor.
bigger. Yeah.
They will do the breast exam and they then refer you to the proper channels, which normally is your tertiary, which is your hospitals, where
Okay.
they now do proper investigations to get a diagnosis whether it's cancer or not. And
Okay.
as I always say, early detection, early detection,
Yeah.
early detection.
If there's one thing I'm gonna remember, it's early detection.
Screening and early detection.
Screening and early detection. Deal.
So the reason why we do the screening is to get the early detection.
It makes sense.
So
Hand in
the
hand.
early detection, well, it increases how can I say? It increases the outcome, the good outcome or the proper outcome, or the outcome we want. It increases the effectiveness basically of the treatment. The earlier detection, the the more difficult it is to eat. Because we all know, or maybe we all don't know,
Yeah.
the longer you wait
Yeah.
with cancer, the more at risk you become to die. Because cancer spreads.
So you mean to tell me if it was only breast cancer, it moves?
It moves. It moves, it spreads. Remember earlier we said what causes
Perfect
cancer.
sense.
Those changes in the abnormal cells, and we
Yes.
said they rapidly, yes. So they grow rapidly, and that is what happens.
Right.
Yes.
Okay.
So all of this comes to, as I said, the screening, which is the breast examination.
Yes.
And people tend to think you need to go to the doctor to do it. You need to go to the clinic.
Yeah.
We all know we have lives. You know, life happens.
Yeah.
You have kids, you have homework, you
You're
have
busy.
swimming classes for
Yeah.
this one, and you have soccer for that one, and you have a
Yeah.
husband, and you come late from work.
Yeah.
So you don't always have time to go to the doctor.
Yeah.
You don't have money to go to the doctor.
Yes.
We all know medical health care these days is very expensive.
Yeah. And when you think of clinic, you think of I'm gonna sit the
In a
whole day.
queue, yes.
Yeah.
So there are things such as a breast exam that you can do yourself at
All
home.
right.
Then you're going to look for those abnormalities. Also, you're going to observe your breast, and then you're going to do a breast exam, which is quite easy.
So you're gonna explain it to us?
Yes, I can show you guys, but we use a lot of internet these days.
Yeah.
Sorry. So you can also Google these things.
Yeah.
So breast exam, there's two ways of doing it. You're going to do it while lying down flat on your bed, or
Okay.
you're going to do it, as we always say, standing straight up in the mirror.
All right.
So how you're going to do a breast exam is, be it flat or in the mirror. If you're going to examine your left breast, you're always going to use your right hand.
Okay.
If you're going to do the right breast, you're always going to use the left hand.
All right.
So when you examine the left breast, you're going to use the right hand. Your left hand will then be up behind your head
Okay.
for the breast to be more exposed.
All right.
So you're always going to use your, as I said, the right hand. You're going to use basically your fingers, the
Yeah.
flat side of your fingers, not the tips of your fingers, the flat side of your
All right.
fingers. Okay. So you're going to divide your breast into 4, okay,
Section.
imaginary
Right.
sections.
Yeah, please not literal.
Yes. So then what you're going to do is, in this position, you're going to start at one section. We divide it as not to miss.
Okay.
And remember, when you do the breast exam, you're going to start, for example, in the upper outer.
Yeah.
That's what I'm choosing, upper outer section.
Yeah.
And you're going to go around flat.
All
Okay?
right.
So you're going to start at the lower part of the breast.
Yeah.
And you're going to go around the breast. Coming up in circular motion.
Yeah.
Still flat, not to move.
All
Miss
right.
any
Spots.
spots.
All
So
right.
you're still going to go around the breast.
Yeah.
Around, remember, mine is now quite small and others have bigger. So you're going to go,
Yeah.
you're going to have quite a lot of circular movements.
Yeah.
But without lifting your hand. So it's going to be a continuous movement around the breast until you end on top of the nipple.
All
and then you're
right.
still going to do that. So you're going to do
Okay.
that every month at home. It's free. It takes 5 minutes of your time and it saves your life. Early detection.
Sure.
You know?
So you can do it yourself, or someone at
Your
home
husband
help
can
you.
do it for you.
Ah,
Yes, your
alright.
husband can do it for you. And you know, a lot of us, there's a lot of myths
Yeah.
regarding breast cancer and
Yeah.
cancer in general.
Yeah.
Specifically with breast cancer, you know,
Yeah.
people tend to think I'm young,
Yes.
I'm not at risk.
And also, my mother doesn't have it. My family doesn't have it. So
Yes.
that is a lie.
It's not the truth. People want to say it's a lie, but it's not the truth. So when there's a family history, you know, all women are at risk of breast cancer. But
Huh.
when there's a family history, as we call it, because your mother and your aunt and your grandmother, it increases your risk.
Okay.
Yes. Also having babies like after the age of 30
Yeah.
or not having babies, it also increases your risk.
Sure. Who would have thought there's
Who would have
benefits
thought?
to having babies young?
Yes. So that also puts you at risk of
Sure.
also things like your lifestyle, the alcohol use, as we said earlier,
Yeah.
your tobacco,
Sure.
you know, obesity and being overweight, it increases your risk
Sure.
of cancer. you
So
know.
there's other reasons to jump, not just to look sexy.
Yes,
There's-
yes. Your health
Yeah.
is very important.
Motivation.
So those are the myths around breast. You know, people tend to think, as I've said, I'm a woman.
Yeah.
You know, my husband is a man. Men can also get, as I've
Yeah.
also mentioned earlier.
Yeah.
men
Would
can
his
also get.
examination be the same, and should it also be as frequent as one would
No,
do
no,
for
he's
female?
actually going to see for the abnormalities in the breast. Yes.
You wouldn't have to do the
The
examination.
breast
and all that.
examination he can also do, because lumps, as I've said, the lumps might occur,
Huh.
and maybe not in the breast,
Yeah.
but around the breast, as I've said. In the
Okay.
axilla or the underarm, there might be glands that he realizes, there was something small like a pea, now it's becoming more like a grape, those type of things.
Okay.
Yes. Some discharges, the
The same as it is for a
Yes,
female.
yes.
And then when we look at when it's that time of the month, the boobs grow. So now you
Yes.
feel lumps and all of that. So how do you
Remember,
not?
there is we have breast tissue.
Yeah.
The same as when you're breastfeeding.
Yeah,
The breast
yeah.
tissues, yes, you might think this is a lump,
Yes.
but no, it's the breast tissues because you're breastfeeding.
Okay.
So that's why it is important to do it after you menstruate.
Okay,
Yes,
okay.
after your menses.
Mental note.
Yes.
All
And
right.
also remember, during your menstruation,
Yeah.
some of our boobs swell, sorry.
Yeah.
Swell. They swell, they become enlarged. So those are also things you're gonna do the examination in after then your menstruation. Because
Okay.
remember, now you're gonna think, oh, this one is bigger than
Bigger,
this one.
yeah.
And then you're gonna become all scared and
For nothing, possibly.
yes.
And with pregnancy, what would the advice be then?
Also just the same. We also do breast examination for all pregnant women.
All
In
right.
your first physical examination, that's why we do a thorough
Yeah.
full physical examination when you're pregnant, and then we teach you how to do it, as I've said. Health
Yeah.
education, health education, health education.
Yeah.
We teach you how to do it. Sorry, and then you're going to do it at home every month.
Okay.
Yes.
Awesome. I
Yes.
think you covered it all, and we've learned so much.
Thank you, guys.